ideology get in the way of sound public health policy.
In Texas, Planned Parenthood is really the largest women's health provider. That means outside of performing abortions, they're providing birth control, they're providing contraception, they're providing well-woman exams, cancer screenings. Republican lawmakers in Texas want them out of that business altogether because they fear they could be directing women to get abortions.
So how would you characterize the last legislative session here in Texas?
In this last legislative session, lawmakers really targeted Planned Parenthood, and they did that, A, by dramatically slashing funding for family planning statewide, because Planned Parenthood was a large recipient of those funds, and B, really trying to rewrite a women's health program to exclude Planned Parenthood from that program altogether.
And that's the Women's Health Program.
That's the Medicaid Women's Health Program. And that was a program that received 90% of its funding from the federal government and 10% from Texas. And what Texas lawmakers said basically is, if Planned Parenthood gets to participate in this program, we don't want this program, we don't want those federal dollars for this program, we will run it on our own.
And why? I mean, why Planned Parenthood?
So the concern among Republican lawmakers is that Planned Parenthood is an affiliate of abortion providers. While Planned Parenthood clinics that get state or federal money cannot perform abortions in Texas, Republican lawmakers fear that that line is not clear enough. They worry that any state or federal dollars that go to Planned Parenthood can in some way fund abortions. This is a very new approach. You know, traditionally, Texas has obviously been a conservative state, but even some previous conservative lawmakers in Texas really saw family planning as a fiscally conservative thing to do.
So, I mean, just again, give me perspective. You know, for the next 2 years, there will be 2/3 less money for these family planning services. What does that mean?
What that means is dozens of clinics will receive no money at all. We've already seen a number of these clinics, you know, booted from the program or else, you know, being forced to close their doors. And if they could have handled that, if they could have handled this 2/3 cut, they definitely can't handle the closing of the women's health program. They definitely can't handle, you know, not having that influx of federal dollars. So, you know, I think it's yet to be seen, again, what ends up happening with the women's health program. But what you have here are a lot of small clinics in far reaches of the state that relied on this state funding to operate their women's health programs, and they just can't do it without that support.
And there's a lot of talk about these federally qualified health centers. We visited one ourselves. They seem pretty, I mean, it's great, they're comprehensive, they provide a lot of care, but is it possible, you know, for them to replace all these clinics that have closed? I mean, are they the answer?
I've talked to a number of directors from FQHCs around the state, and they have said, you know, consistently, there's no way we can replace, say, a Planned Parenthood. There's no way we can replace these women's health clinics in our community. You know, the reality is the FQHCs are wonderful, but the services they provide are broad in scope, and they're provided to a whole wide range of the population. You know, the benefit of these women's health clinics is that they really focused on women. Women were comfortable going to them. Planned Parenthood, for sort of a whole generation of young women, is sort of the safe place to go. So I think what you're going to see is that women who traditionally felt like they had a place to go don't go anymore, don't get these kinds of services anymore, or simply can't afford to get them anymore.
And what is the public reaction to this?
You have to remember that we're in Texas, and this is a state that is an overwhelmingly conservative voting populace. So the people who turn out to the polls in Texas are overwhelmingly Republican. Rick Perry has been in office for 11 years. He's our conservative governor. You don't see the kind of outcry in Texas, for example, that you saw in Virginia when similar legislation to this was raised. I mean, this is a state that is just so institutionally Republican that outside of Democrats beating this same drum, you don't see a rush to the polls.